A fractured tibia will be the bone model used to apply multiple external fixator configurations. The fracture fragments are held in a reduced position in the vise. A stab incision through soft tissues has been simulated, indicating the position where the drill sleeve assembly will be introduced on the medial side of the proximal tibia. The trocar is removed, and the 2 mm drill bit is used to create a hole through both cortices. The internal sleeve is removed and a K-wire with trocar tip is inserted. A second K-wire is placed in the distal fragment, close to the joint. In this external fixator configuration, the closed clamp shown on the left will be used. The clamp is slid down the pin until it is approximately 1 centimeter from the skin. It is tightened in this position. A connecting bar is inserted into the clamp. An appropriate number of clamps have been pre-placed on the connecting bar. The other end of the connecting bar is inserted into the clamp on the distal end of the bone. The nuts are tightened, securing the K-wire and bar in place. Additional K-wires will be placed into the bone by drilling through the clamps. The drill sleeve assembly can be used through the clamp to aid in placing the K-wires. A wrench is used to secure the K-wires and the connecting bar. A unilateral uniplane external fixator configuration has been constructed. In a clinical case, the K-wires will be cut off as shown on the screen. This should not be done in the laboratory, as these K-wires will be used later. To construct a bilateral uniplane configuration, start by placing fixation K-wires parallel to the joint surfaces at either end of the bone. Connecting bars have been added to the configuration, one on either side of the bone. Clamps have been pre-placed on both bars so that K-wires can be inserted. The K-wires have been added to the configuration. These K-wires are located close to the fracture line to increase stability at the fracture. At this point, the open clamp, shown on the right, may be used to add more K-wires to the connecting bars. The open clamp is attached to the connecting bar. Additional K-wires have been inserted. Once again, in a clinical case, the K-wires extending beyond the frame should be cut off at the level of the clamps. Do not do this in the laboratory. To convert this frame into a bilateral biplane frame, a single bar is placed along the cranial surface of the tibia with a K-wire at either end of the bone. The side connecting bars have been fixed to the cranial connecting bar by adding open clamps and a connecting bar. This creates a bilateral biplane external fixator. This computer animation illustrates the three-dimensional aspects of this frame. The configurations that can be developed with an external fixator are limited only by our imagination.